The Invisible Crisis in Hospital Care, a new clinical protocol exposes systemic neglect for severe neuroimmune diseases. The publication of the Hospital Care Plan for Severe Very Severe ME/CFS and Long COVID by ANSMIS represents a critical, long overdue intervention in a landscape defined by profound medical neglect.
This document directly confronts the dangerous inadequacy of standard hospital protocols for patients with myalgic encephalomyelitis/chronic fatigue syndrome ME/CFS and long COVID, who frequently experience severe harm including permanent functional decline from routine interventions. Its creation signals a pivotal shift from patient advocacy to formalized clinical guidance, aiming to prevent iatrogenic damage by mandating specific accommodations for post-exertional malaise PEM, sensory sensitivities, and dystonia.
The urgency is amplified by the post-pandemic influx of long COVID patients presenting with nearly identical pathophysiology, creating a public health imperative that can no longer be ignored.
A legacy of misunderstanding and harm. Historical diagnostic ambiguity has created a therapeutic vacuum now filled by evidence. For decades, ME/CFS has been marginalized within medicine, often misclassified as a psychiatric condition, leading to the application of actively harmful treatments like graded exercise therapy.
The severe and very severe patient population, often bedbound, tube-fed, and exquisitely sensitive to light, sound, and cognitive activity, has been particularly invisible, with no standardized inpatient care. The ANSMIS care plan shatters the status quo by translating decades of patient-lived experience and emerging biomedical research into actionable clinical steps.
It codifies the understanding that these are multisystem neuroimmune diseases with clear pathophysiological mechanisms involving energy metabolism, immune dysregulation, and neurological dysfunction, thereby moving care from a paradigm of suspicion to one of physiological accommodation.
Deconstructing the protocol's core innovations, the plan mandates a radical deprioritization of standard metrics in favor of symptom-led management. The protocol's sophistication lies in its explicit rejection of conventional hospital priorities.
It subordinates standard vital sign monitoring and mobility encouragement to the paramount goal of preventing PEM, the hallmark disease exacerbation triggered by minimal physical or cognitive exertion. Key operational directives include the creation of a sensor-protected environment, the use of horizontal triage and admission to avoid orthostatic stress, and the strict minimization of non-essential interventions.
It provides specific guidance for managing common comorbidities like POTS and MCAST, and crucially it advises on communication strategies for nonverbal or cognitively impaired patients. This framework effectively re-engineers the hospital environment around the patient's homeostatic fragility, treating sensory and metabolic overload with the same urgency as a physiological crisis.
A benchmark for global clinical reform, this protocol sets a non-negotiable standard, creating liability for institutions that ignore it. The ANSMIS care plan is not merely a guideline, it is a de facto standard of care that establishes a clear medico-legal benchmark.
Healthcare systems that fail to adapt their protocols accordingly risk being implicated in negligence for causing demonstrable harm to a vulnerable population. The strategic projection is that this document will serve as a template for global adaptation, forcing systemic change through both clinical education and legal precedent.
The immediate next steps involve aggressive dissemination to emergency department staff, hospital administrators, and medical educators, while parallel advocacy must focus on securing formal endorsement from national health ministries. The long-term opportunity is to leverage this framework to redefine disability accommodation and catalyze research into targeted inpatient therapeutics, ultimately dismantling the institutional inertia that has perpetuated this crisis.